I am an orthopedic surgeon, and if you are over 60, I can tell you one thing with certainty: morning stiffness is not just normal aging, and it is not something you should ignore. Every day, I meet seniors who wake up feeling locked, stiff, and afraid to move, needing 30 minutes or more just to stand straight. Knees feel jammed, the lower back feels wooden, and the body feels older in the morning than it did the night before. Most people believe painkillers or intense exercise are the only options, but that belief is wrong. In Japan, seniors follow a very gentle morning stretch that wakes up the joints, restores circulation, and protects mobility without strain. In this video, I will show you exactly what that stretch is, why it works after 60, and how doing it every morning can change the way your entire day begins. The main reason morning stiffness becomes so severe after 60 is simple. During sleep, your joints stop producing enough natural lubrication, blood circulation slows down, and muscles remain in a shortened position for hours. This causes the connective tissue around your knees, hips, spine, and shoulders to tighten overnight. When you wake up, your body feels rusty, heavy, and painful, not because your joints are damaged, but because they are cold, dry, and inactive. This is exactly why the Japanese Radio Taiso morning stretch, a traditional daily movement routine practiced by seniors in Japan, works so effectively. This is not aggressive exercise, not yoga, and not physical therapy. It is a slow, circulation-based stretching method designed to gently wake the joints, stimulate synovial fluid, and restore movement safely for aging bodies. Radio Taiso focuses on synchronized breathing with slow joint movements, starting from the spine and flowing down to the hips, knees, and ankles. The core movement that helps morning stiffness is called the seated spine and hip awakening stretch. You can do it sitting on the edge of your bed or on a chair. Sit upright, feet flat on the floor, hands resting gently on your thighs. Inhale slowly through your nose as you lengthen your spine, imagining your head being gently pulled upward. As you exhale, slowly tilt your upper body forward just a little, not forcing the movement. This gentle forward motion loosens the lower back and hips without compressing the spine. You repeat this slow movement 6 to 8 times, breathing calmly. This alone begins warming the joints and signaling the body that it is safe to move. Next comes the knee and ankle activation movement, which is essential for seniors who feel locked knees in the morning. While seated, gently extend one leg forward, straighten it only as far as comfortable, and slowly flex and point the ankle. This movement pumps blood into the knee joint and lubricates the ankle without strain. Hold for a few seconds, then lower the leg and repeat on the other side. This activates the muscles around the knee and improves circulation to areas that stiffen the most overnight. Most seniors notice that standing becomes easier immediately after this step. The final part of the Japanese morning stretch is the gentle shoulder and neck release, because stiffness does not only affect the lower body. Sitting tall, slowly lift both shoulders toward your ears as you inhale, then relax them completely as you exhale. Follow this with slow neck turns, turning your head slightly left and right without forcing the movement. This reduces tension, improves blood flow to the brain, and prevents dizziness when standing up in the morning. The entire routine takes about 5 to 8 minutes, but its impact lasts all day. What makes this Japanese stretch different from regular stretching is that it respects the aging body. There is no bouncing, no deep holds, and no pain. Pain is never the goal. Mild warmth, gentle pulling, and a feeling of looseness are the signs you are doing it correctly. This routine works because it restores joint fluid movement, wakes up sleeping muscles, and improves nerve signaling between the brain and body. Many seniors feel more stable, confident, and mobile after just a few mornings. You do not need supplements, equipment, or medications for this routine. However, hydration plays a supporting role. Drinking a glass of warm water after waking helps thin joint fluids and supports circulation, making the stretch even more effective. Some seniors also benefit from natural anti-inflammatory foods like ginger tea or turmeric in their breakfast, but the stretch itself is the foundation. Without movement, no remedy can fully reduce stiffness. This Japanese morning stretch is safe for most people over 60, including those with mild arthritis, knee pain, or back stiffness, as long as movements stay slow and comfortable. It does not replace walking or exercise, but it prepares your body so those activities feel easier and safer later in the day. When done daily, it helps prevent worsening stiffness, reduces fall risk, and protects independence. Morning stiffness does not mean your body is failing. It means your body needs the right kind of movement. This stretch gives it exactly that. Once you begin doing this Japanese morning stretch daily, the changes you notice are not accidental. They happen because your body is finally receiving the kind of movement it can safely respond to after 60. The first improvement most seniors report is that the feeling of being locked in the morning starts to fade. Knees no longer feel jammed when standing up, hips move more freely, and the lower back no longer feels like a solid block of wood. This happens because slow stretching combined with breathing increases synovial fluid inside the joints, which acts like natural oil. Aging joints do not lose movement overnight because they are broken. They lose movement because they dry out and cool down during sleep. This stretch gently warms them back to life without shocking the system. Another major benefit is improved balance and confidence. Many seniors do not realize that morning stiffness affects balance more than strength. When joints are stiff, nerve signals from the feet, knees, and hips reach the brain more slowly. This increases the risk of missteps and falls, especially during the first hour after waking. The seated spine and hip movement and ankle activation restore communication between the nervous system and muscles. Over time, this improves coordination and reduces the fear of falling, which is one of the biggest hidden problems in older adults. When fear decreases, movement becomes smoother and more natural throughout the day. This stretch also plays an important role in managing arthritis-related stiffness. Arthritis pain often feels worse in the morning not because joints are inflamed overnight, but because immobility allows surrounding tissues to tighten. Gentle movement signals the body to release protective muscle tension. The key is that this routine never forces joints beyond their comfort zone. For seniors with arthritis, forcing movement causes inflammation, while slow controlled motion reduces it. This is why aggressive stretching programs often fail older adults, while gentle routines succeed. Many seniors make mistakes when trying to stretch on their own. One common mistake is stretching too hard in an attempt to break through stiffness. This sends danger signals to the brain, causing muscles to tighten further. Another mistake is holding the breath, which reduces oxygen flow and increases tension. Some people rush through movements or compare themselves to younger bodies, which leads to frustration and injury. This Japanese approach removes competition entirely. The only goal is smooth movement and relaxed breathing. Progress happens quietly without force. This routine is also highly adaptable. If you wake up with severe back stiffness, you can reduce the forward bend and focus more on breathing and posture. If knee pain is your main issue, you can spend extra time on ankle pumps and leg extensions. If balance is a concern, everything can be done seated until confidence improves. Even seniors in their 70s and 80s can safely follow this approach because it works with the body rather than against it. The most important rule is simple: movement should feel relieving, not painful. Results often begin sooner than expected. Many people feel lighter and more mobile immediately after the first session. Within a week, standing up from bed or a chair becomes easier. After 2 to 3 weeks, morning stiffness shortens dramatically, and the body feels more prepared for walking or daily activities. Over time, this routine can help slow the progression of stiffness-related decline, preserving independence and reducing reliance on pain medications. It does not promise miracles, but it creates consistent improvement through safe repetition. Consistency matters more than intensity. 5 to 8 minutes every morning is far more effective than one long session done occasionally. The body responds to regular signals of safety and movement. Skipping days allows stiffness to return, while daily practice trains joints and muscles to remain flexible. This routine becomes a form of maintenance, like brushing your teeth for mobility. It is not about pushing limits. It is about protecting what you already have. Perhaps the most important benefit is psychological. Morning stiffness often makes seniors feel older than they are, leading to frustration and fear. When mornings begin with controlled movement instead of pain, confidence returns. Confidence leads to activity, activity leads to strength, and strength supports independence. Aging does not mean surrendering mobility. It means choosing smarter ways to move. This Japanese stretch is not just an exercise. It is a daily signal to your body that movement is safe, possible, and worth preserving. To get the full benefit from this Japanese morning stretch, it must become part of your daily routine rather than something you do only when stiffness becomes unbearable. The best time to perform it is immediately after waking, before the body has fully cooled or tightened further. You can do it on the edge of your bed or seated in a stable chair, making it accessible even on days when energy feels low. The goal is not to wake up and rush into activity, but to gently prepare the body for movement. Slow breathing is essential. Inhale through the nose, exhale through the mouth, and let each movement follow the breath. This signals safety to the nervous system and allows joints to release tension naturally. Consistency is what creates lasting change. Doing this routine every morning, even for just 5 minutes, teaches your joints and muscles to expect movement instead of stiffness. Over time, the body begins to hold flexibility longer into the day. Pairing the stretch with simple habits can enhance its effects. Drinking a glass of warm water afterward helps circulation and joint hydration. Taking a short, relaxed walk later in the morning keeps the joints moving without stress. Paying attention to posture while standing and walking prevents stiffness from returning quickly. Safety should always come first. Movements should remain slow, controlled, and comfortable. Sharp pain, dizziness, or breath holding are signals to stop or reduce intensity. Seniors with recent surgery, severe osteoporosis, or acute injuries should move gently and consult a professional before starting any new routine. This stretch is designed to support the body, not challenge it. There is no benefit in pushing through discomfort. As an orthopedic surgeon, I have seen many seniors regain confidence simply by changing how their mornings begin. When the day starts with calm movement instead of fear, everything else becomes easier. Standing, walking, dressing, and even mood improve. Morning stiffness does not define your future. With the right movements, it becomes manageable, reversible, and far less frightening. This simple Japanese stretch is a small daily investment that protects mobility, independence, and quality of life. If you found this helpful, support your body by staying consistent, and support this channel by liking, subscribing, and sharing this video with someone over 60 who wakes up stiff every morning.